So Helen came from Philadelphia. She is a rescue hen. Her mom couldn't take care of her anymore because she had to have hip surgery. She's an older girl. We think she's maybe 8 or 9. Still laying. She's a barred rock. She's a big girl. She's got some meat on her bones. A little junk in the trunk. And anytime she jumps down from high perches, she's putting all her body weight on her feet, which get little kind of cracks in the skin, and then bacteria can enter. So she has staph infections on both feet. It's known as Bumblefoot. Excuse us, that was her bottom. So here's a look at them. Her feet are always, she's big feet, but these are really swollen with infection. So she's going to need oral antibiotics as well as we're going to kind of topically treat this. Yes, I do this in the kitchen, but I sterilize everything when I'm done. It's just easier. It's air conditioned in here. The lighting's better. I have all the tools I need. So this is just in our mudroom sink. So she's gonna sit in here for maybe 15 minutes and chill out. So I have all my stuff ready ahead of time. I've got little sterile pads cut into pieces, some tweezers and tools to use, antibiotic ointment. These are vet strips. I like the kind of narrower width. And I have some chlorhexidine to sterilize her foot. And paper towel, because she's gonna bleed. She's a bleeder. So I've washed her in the sink in just a mild dish soap detergent and scrubbed her feet clean. Now we're going to sterilize her feet as well. We're going to do one at a time, and I like to use a towel to keep them from wiggling away from me. She's a pretty good girl, but she's stressed out. Come here, baby girl. So we're going to wrap you up. There we go. Right, and it always helps to have a second pair of hands, but my second pair of hands is filming this. So we're gonna give this a little squirt. I'm wearing gloves because this is a staph infection. It's really infectious. People also, she bleeds a lot, so if you're squeamish, look away. So I got these softened in the sink. Had her in there for a few minutes. But when the infection's pretty advanced, we're only gonna get a little bit out. Get this black spot off. I know, sweetie. Here, it's starting to come off. It's so much easier to do without gloves, but we really need gloves for this, especially when we're recording it for posterity. So here she's starting to bleed. We'll bandage her. I really don't know how much of this is infection because it's still really soft. So she's chronic with this. This happens all the time with this hen. She's just so big and frankly a little chubby. And while I do love my chicken coop, it is the roost bars are really high, unfortunately, so it offers a lot of possibility for them to injure themselves. So I'm getting these little chunks off. Yes, this doesn't feel good for her, but the infection doesn't feel good either. And if this gets advanced, it goes systemic, and it can actually kill a chicken, but they usually will start to limp much before that gets that advanced. So I've gotten all the little black spots off. She's so chubby, sometimes she gets spots inside the webbing of her feet here. That's just dirt. So we've got that off. Now we're going to get a sterile pad that we've cut into a little section, and then I'm going to attempt to do this single-handedly. We use, oops, I forgot, Jared. Forgot the antibiotic ointment.
I was keeping my mouth shut.
A little squirt of this on a clean finger. Just pack that wound. Use a fresh one here. And you're being such a good girl, Helen. So you want this tight enough that it doesn't come off when they're being outside being active and scratching around, but not so tight that it cuts off the circulation. I will leave this on for a few days and then check her in a couple days. Just redress the wound, put a little fresh antibiotic ointment on it. This will take several weeks for her to clear up. Interestingly, she does not limp when this happens. I try to check all my hens before they start to limp. Jared will laugh that every time I am outside with the chickens, I'm constantly picking them up and looking at their butts and their feet for any signs of diarrhea or bumblefoot. So that's fun. Fun fact in the Leonard Werner household. So we're good here. This stuff kind of sticks to itself. And wrap it all the way up the ankle. And then press it together. So you can see she's bleeding through, but that'll be fine. I know, sweetie, we're gonna do the other one, then you're all done. And you're gonna get some grapes. You can see the white pus coming out. Chickens often have pus will be pretty hard. This is still pretty soft. So like I said, I'm gonna put her on oral antibiotics, so I'm not gonna try too hard to squeeze all this out and cause her a lot of discomfort. Little chlorhexidine.
Shout out to Nate the Hoof Guy. She's gonna go in I have a little dog crate in my home office, so she'll go up in there for an hour or two just to kind of help these kind of clot off and make sure she's not this bleeding too actively to put her back in coop. But she will clot up real soon. Right. Okay. Job done. So I want to put her on oral antibiotics because
this infection is a little more advanced to just treat it with topical antibiotics. So the easiest way to do that, I use an oral antibiotic. It's enrofloxacin. It's known as Baytril. Some people don't like using Baytril. These are pet chickens. I'm never going to eat their meat, and I am not going to eat any eggs from her for several weeks. So works really well. One of the best medications available. So I've already measured it out in my syringe. The easiest way to get a syringe down a hen is you kind of gently open the mouth. She's perfectly fine, other than wiggling away from me. And you get your finger in between the upper and lower beak.
I'm ferocious.
And then when we insert the syringe, we're going to go all the way down the throat. So you can see where the plunger is almost at her mouth. So the tip of that is way down here. We're not going to get in her airway. We depress the plunger and she's all set. That's it. She's on her way to recovery. She's preening. That's always a good sign. What are you doing in here, sweetie? Ready for some sex? Turn around. Turn around and get some treats. Oh, there you go. Good job. Come here, my friend. That's a girl. Such a brave chicken. Back with all her friends. Hi, buddy. Don't worry. Were you worried about her? Yeah, she's okay.